Time to check in with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19. Good to see you via Skype.
Good morning, Bob.
There you are. Yeah. Let's start with the modeling data that came out yesterday, and they talk about these variants, or one in particular, has become a significant threat. And it came up yesterday. There's a possibility this could change up. Could this mutate again, where vaccines aren't as effective?
Yeah, I mean these viruses are changing, and these aren't large mutations. These are small mutations that are happening. Again, some of them give the virus more fitness and the ability to infect better. Some of them give a little bit more escape from the immune system. We're going to see this happening. I mean, the places in the world where these are derived are where there is a significant amount of transmission ongoing, like the UK, Brazil, South Africa. I think this is going to be a long-term problem. But the best news is that we have is the current vaccines are still effective for these variants. There may be slightly less response, but there still is a fairly good response, which is enough to say we need to start vaccinating ASAP.
Yeah, it's a critical time. Novavax is in the news this morning. They're saying they have an 89% efficacy against the UK variant, and that's actually on Canada's shopping list. We've purchased, 76 million doses?
Yeah, absolutely. So this is an interesting vaccine. It's very different than the other vaccines. So mRNA vaccines were used to make the body make spike protein. This is essentially spike proteins, the actual protein itself, that's complexed onto a nanoparticle. So it almost looks like a flower of different proteins around it. The efficacy seems to be reasonable. The cold chain requirements are reasonable. It did have activity again in the UK where they did the trial during the UK variant at times. It is slightly less effective against the South African variant. So in their trial in South Africa, they had about 60% effectiveness. But, knowing our cold chain issues, knowing our supply issues, more is better right now. And there is going to be obviously a push to get this out there. Having something that's 60 to 80% effective is still better than nothing at this point. And getting more Canadians vaccinated is going to be incredibly important, especially as the UK variant starts circulating here.
Yeah. Now back to the Pfizer vaccine and the relabeling and squeezing that sixth dose out that Pfizer has requested, and not just Canada, but other nations, and the US and the EU have complied. But it requires a special syringe for this, correct? That maybe we don't have?
Yeah, so this is low volume syringe. We have some, but they're in very low supply. There is a big national order for some, but again, it's coming in, trickling in over the next few months. And now, obviously, there's going to be a huge supply issue for this because every nation on earth who has Pfizer wants to get these syringes. Even in the best case scenario, though, this takes a really skilled pharmacist or pharmacy tech to actually extract it. You have to know what you're doing. And even in the best case, only about 75% of the time people are able to get that last dose out. So, it is a bit disappointing, obviously, that people figured out how to get this last dose inconsistently, and now it's being held against them. There is a push from Pfizer to do this. I hope we can at least show them our data saying it's not always feasible, and Pfizer meets us somewhere in between to say, okay, we're going to give you more doses, but account for some of this rather than all of this.
Yeah, we've been talking so much about vaccines and getting on top of this. But for those that have COVID, where are we at on treatments? There's a Quebec company that's come up with something, actually a treatment that's been repurposed.
Yeah, so there was a big clinical trial done out of the Montreal Heart Institute for a drug called colchicine, which is a really old gout medication. It's used for other conditions as well. In people who just got COVID-19, particularly higher risk individuals, so over the age of 40 with diabetes, high blood pressure, heart failure, or fairly symptomatic, it reduced hospitalizations. Now, it wasn't a huge number. You'd have to give the drug to about 70 individuals to prevent one hospitalization. Those who got to hospital had a slightly lower risk of ventilation and death, although it's not clear if that's just small numbers or that's really statistical. And so it is a potential tool. It really is a drug that has a significant side effect profile and interacts with a lot of medications, though. So most people who take this medication get diarrhea, about 10%. And again, it interacts with things like cholesterol medications, heart rhythm medications, and that type of thing. So, it is a potential option. It's something to talk about with their physicians and healthcare providers if they get COVID. But realize that it's not necessarily going to prevent people from getting that sick. It might help with reducing hospitalizations. But there are interactions and other considerations. So not everyone should be taking this medication if they get COVID.
Okay, well, thanks for your input on all these developments, Dr. Zain Chagla. And have a
No
good
problem.
weekend.
All the best.
All right.